It's a concerning trend. More people under the age of 50 are dying from colorectal cancer. KLTV7's Emma Burns has more tonight on how regular screenings and early detection could save your life.
The leading cause of cancer deaths in the United States for people under the age of 50 is colorectal cancer, a cancer caused by polyps in the large intestine. Christus Health gastroenterologist Dr. Ruchir Patel says cases in adults, both men and women, under 55 are on the rise.
It is one of the few preventable cancers if we can catch colon polyps early and prevent them from turning into colon cancer.
Patel says a colonoscopy is recommended every 10 years starting at the age of 45. Screening may begin earlier for individuals with a family history of the disease. And as for what could cause the cancer,
it is multifactorial, so there are different factors from genetics, there can be environmental triggers, and even some lifestyle. So physical inactivity, obesity, and even consumption of certain types of food, so processed meats and sugar-sweetened beverages. So we do recommend that patients eat fruits, vegetables, whole grains, and fibers to try to decrease their risk of colon cancer.
Common red flags Patel says to look for are blood in the stool, a rapid change in stool habits and size, and rapid and unintentional weight loss.
We are seeing more of it. It is important that patients are aware of this issue.
The CDC says colorectal polyps and colorectal cancer don't always cause symptoms, especially at first, meaning proactive and preventative screenings could save your life. Emma Burns, KLTV 7 News.
Now, if you notice any of the warning signs Dr.